Hello, it's Dr. Tugbiyele here, Urogynecologist, and in this video we're going to answer the question, what is constipation? So constipation is infrequent bowel movements. In the normal sense, we should be having bowel movements every day, and in fact some women have bowel movements more than once a day, depending on how healthy their diet is and how much fiber content or their activity level, but at least every day to every other day. So we're talking 3 times a week. And so when there are bowel movements less than 3 times a week, or if there's excessive straining with bowel movements, or not feeling as if you've completely emptied your bowels, then that is an indication that there could be an issue with constipation. It's a very common condition that affects about 1/3 of women, and a lot of women feel that they're the only ones and they suffer in silence, and constipation leads to oftentimes excessive straining on the pelvic floor, which then can cause other issues like prolapse, the bladder falling, the uterus or the vagina falling, and causing pain. And so it's not a condition that women feel like they should live with. It affects quality of life, and there are good solutions, and we'll get to that later in this video. And so what is normal stool caliber? And this will get a little descriptive, but hey, I'm a urogynecologist. We're used to talking about this all the time. So a normal stool should look like a banana. It should be soft, smooth on the surface, squeezed on both ends for obvious reasons. And that is the normal consistency stool. And there's actually a chart that actually describes this and kind of characterizes normal stool. It should not be hard or cracked on the surface. It should not be lumpy or essentially balls. That is not normal bowel movement consistency, nor should it be like blobs or kind of jagged edged blobs, for lack of a better word, or it should not be liquid. Obviously, it should not be diarrhea. So when it's a normal consistency, kind of middle run of the mill, then that is a normal bowel movement. If it's hard, if it causes straining with bowel movements, if a woman feels she's not completely emptied her bowels, if you feel they're lumpy, or that you haven't completely emptied your bowels afterwards, then that is an indication of constipation. Again, it affects many women, and some of the risk factors definitely is more commonly seen in women who've had vaginal childbirth, because sometimes after vaginal childbirth the pelvic floor muscles don't work properly, and so women are not able to have to empty completely afterwards. Or as a result of childbirth, there might be a defect in the vaginal and pelvic floor muscles, a tear, changes in the nerve function that affect bowel movements, so that can lead to constipation. Diet is another aspect of it. We know water intake, staying hydrated, and fiber is very important. And when women are not getting enough fiber in the diet, the stool does not go through the colon as effectively and efficiently, especially if the diet's high in meat. We know that's harder to digest. All processed foods, spicy foods, those kinds of things don't digest as well, and so that can lead to women feeling constipated. Lifestyle. You know, if we know women who are physically fit and have a high activity level tend to have better bowel movements, and so a sedentary lifestyle is another risk factor for constipation. I mentioned anatomy. The pelvic floor needs to be working properly, the nerves, the muscles, the ligaments, and when they are not working properly, that can lead to constipation. So when we talk about an evaluation, we of course get a history first. We find out, medical, surgical, what are some of the things that could have led to changes in the pelvic floor, could lead to constipation. There are some medications. In fact, there are a lot of medications that lead to constipation as a side effect, especially the medicines that they can also cause other side effects like dry eyes, dry mouth. Constipation is one of them that is caused by these certain class of anticholinergic medications. And so we evaluate that and why women are taking those. We also do a physical exam and see how the pelvic floor is functioning. It is the vaginal walls, are they well supported? Is there something we call a rectocele, meaning a bulge of the rectum into the vagina that can act as a pocket where stool can collect, get hardened, and then be hard to eliminate? There's some women who actually have to lean forward or lean back to have a bowel movement, or press in the vagina or perineal area to have a bowel movement. All of those things are indicative of there could be an anatomical or nerve issue that's affecting pelvic floor function. In terms of diagnostic tests, some women, we may need to send them to a gastroenterologist or colorectal specialist that we work in tandem with to perform a colonoscopy. Is there anything else going in the colon that is contributing to constipation? Some women may have a collapsed colon or a rectum that's collapsed that can also lead to changes in pelvic floor function as well as bowel movement frequency. There are certain studies that evaluate how efficiently the stool is going through the colon and starting in the intestines and then, of course, through the colon. So these are colonic transit studies, so to speak, that evaluate things moving along in the right direction and appropriate time. There are certain diagnostic tests that look at how the pelvic floor is working in tandem with the rectum, and is the bowels is the rectum emptied and is at the time of a bowel movement. So there's certain diagnostic tests that can be done to evaluate the pelvic floor. So after that evaluation, definitely we like to reassure women that there are solutions to this condition. We always, of course, start with dietary options and or lifestyle changes. So, of course, we talk about fiber, staying hydrated, and then definitely increasing fiber content in the diet to help the bowels work more efficiently. And there are different ways fiber can be achieved. It can be done naturally in the diet: oatmeal, fiber bars, and certain shakes that have high fiber content. And then there are, of course, artificial fiber products, synthetic fiber products that women can, like Metamucil, Citrasil, FiberCon, FiberSure, and those are mixed in a certain beverage, and that women can get their fiber that way. It can lead to more gas and bloating symptoms when it's a synthetic fiber versus a more natural diet food-based fiber. Pelvic floor exercises are key, again, to keep the pelvic floor muscles working properly so that when women are ready to have a bowel movement and evacuate, they are using their muscles most effectively. Definitely one condition that we see, some women who tighten up their pelvic floor muscles rather than relaxing enough to have a normal bowel movement, that can lead to constipation. So that is more, educating women to relax, and they have to also have relaxed pelvic floor muscles at the time of defecation or bowel movements to empty. And if that is not the case, then some women may need to see a pelvic floor physical therapist to help relax the muscles in order for women to have a normal bowel movement. There are certain medications that can also be prescribed or recommended to help the pelvic floor muscles relax so that women can have normal bowel movements. It may be positional. There's some women who, depending on the length of their legs in conjunction to the commode, they may not be in the right position to have a good, effective bowel movement. And so some of you may be familiar with something called the squatty potty, which helps to elevate the legs and give women a better angle to be able to empty out the rectum appropriately. If a woman's legs, if she's shorter and they dangle, or she leans forward to have a bowel movement, not good. So that squatty potty can help to increase the angle to allow normal emptying of the rectum. Exercise is very key. So staying physically fit, especially aerobic exercise, keeps the system going, blood going, metabolism going, and yes, bowel movements are more regular with women who are more physically active and who exercise. There are medical options, there's stool softeners. Of course, if a woman has an issue with hard stools, stool softeners can be helpful. Laxatives can be helpful, which help to propel stool along. And some of my patients actually choose more natural options like a peppermint tea, a herbal tea, warm beverage. It could be coffee, or it could be warm, like squeezed lemon in warm water, because warm fluids help increase gastrointestinal activity. So any of those options are key. Oatmeal, another great one. And then there's times where surgery is needed. We may need to, if there's a defect in the pelvic floor, for example, as I mentioned, a rectocele, which is a bulge of the rectum into the vagina that is collecting stool, causing the stool to be impacted or hardened, that women then have to press in the vagina to eliminate on the perineum or actually evacuate through the rectum, then that needs to be addressed. And that can be addressed very successfully, actually vaginally. Or some women may need to have their pelvic floor reconstructed. If there's a prolapse of the vagina that's keeping women from having a normal bowel movement, that may need to be lifted. We do work with other specialists like a gastroenterologist or colorectal specialist to determine other causes of constipation that are not necessarily only anatomic. It could be physiologic. So making sure the stools are working and moving along well is key. So I know I mentioned a lot. Again, we like to encourage women that they don't have to, you don't have to live with this or put up with this. There are many women who this is affecting their quality of life and they feel they're alone, and that is untrue. There are good, safe options and solutions that work and that can improve your quality of life. And so seeing a board-certified urogynecologist like myself is key to evaluate your history, evaluate your pelvic floor, do a thorough, comprehensive physical exam, and then arrive at a solution that's going to be effective and improve your quality of life. And so if you are looking for more information, you can visit my personal website at Dr. Dr. Steven with a PH, Tugbiyele.com. That's Dr. Steven Tugbiyele.com. I have other videos and education material there that I feel will be helpful for you. You can also visit my practice website, which is Northside Center for Urogyne.com, or my YouTube channel, Dr. Steven Tugbiyele, where you can also watch other videos and get more information. My office number is 470-325-1280. I look forward to meeting you and evaluating and getting you better and improving your quality of life. And so don't feel you have to live or put up with it. There are good options around the corner. Okay? You take care, be well, and until the next video, bye-bye.